Hey guys, I'm Corey.
And I'm Mike.
And we're both medical students here at the Carver College of Medicine at the University of Iowa.
Alright guys, the first thing we're going to talk about is bones. When you're born with about 270 bones throughout your body, but over time, some of those bones fuse together and you're left with 206 bones as an adult. Now those 206 bones are broken into a few different types of bones, and I'm going to run through them. First, we have our long bones. This is called the femur, and it's the bone of your thigh. So right here, it's right here on our body here. Next, instead of long bones, you have some short bones. Some of the bones are the bones in your hand, wrist, and ankle. So right here and down here. There's another type of bone called an irregular bone. This is the part of the hip bone, about half of the hip bone right here. And this is actually, three types of bones are in that one bone. There's the ilium, the ischium, and the pubic bone. There's also flat bones. An example of the flat bone is your shoulder blade. So that's right here. It's also called the scapula. And then finally, there's a fancy type of bone called a sesamoid bone. And what that means is that it's embedded in a tendon or a muscle. And this is the kneecap. So right here, it's also called the patella. The patella is actually the hardest bone in your body. So now all of these bones, they take up some weight in your body, and that is about 15%. Bone is one of the two organs in your body that can completely regenerate over time. The other is your liver. In order to do that regeneration process, your body needs an element called calcium. Calcium is found in dairy, so milk and cheese, as well as some leafy green vegetables and canned fish with the bones in.
Alright, so we know that accidents happen and people walk around in casts, so obviously bones can break. There's a lot of different types of bone breaks though. Not every bone break is the same. First, you have your buccal or Torus fracture, and that's when a bone, one side of the bone bends but doesn't break and the other stays flat. So you end up with just a little bump. That is called an incomplete fracture. And as I said, it's called a buccal or a Torus fracture. You also have a type of fracture called a Greenstick fracture. It's a partial fracture where one side is broken, kind of like when you pull down on a stick that's still green in the middle, and one side breaks but the other stays complete. That's also a partial fracture. And then moving forward to more complex fractures, you have your complete fractures where they completely break through the bone. The first type is called a closed complete fracture, and that's where it doesn't break through the skin. An open fracture is where it does break through the skin, and that can be in your very bad accidents and can lead to a lot of other issues. Some other different types, there's non-displaced. So that's when, say you have a bone break but they stay together in like the same plane. Those are, that's called a non-displaced fracture. And the opposite of that, you have a displaced fracture, so if it breaks, it can displace and they'll be on a different level. And then moving forward, there's other different types too. You can break a bone in one single spot, so that's just called a single fracture. You can have a segmental fracture where bone is broken into multiple pieces. So take this one for example. You could be in a really bad accident, so you can have a break here and also here, and the two segments you can see on an x-ray, and they're both broken. And then there's also something called a comminuted fracture, and that's when a bone is broken into multiple pieces and can actually be crushed in certain areas.
Alright, so how do we see bones? Both healthy and fractured bones can be seen through something called X-rays. X-rays is a form of electromagnetic radiation, which is a fancy word for light. But this is light that has really small wavelengths that we can't actually see to the naked eye. So, when we have X-rays, they show up a little different. Alright, so what does an X-ray look like? Here is a picture of X-ray that's usually shown in black and white. You can see here at the top there is nice healthy bone because healthy bone is dense and white. Off here to the edges is black, and that's just air because air is not what we call dense. The tissue surrounding the bone is gray because that's denser than air but not as dense as bone. Looking down towards the bottom of the image, we can see one of the types of fractures that Corey had mentioned. This is what's called a non-displaced fracture because the bones are relatively still lined up. If I switch to another X-ray, this one would be displaced. As you can see, the bone is not lined up. This is one of the bones in your arm called the radius. Here is a more complex fracture. This is the one called Comminuted that Corey had mentioned. As you could see, there's many different pieces and it's more of a crush-like fracture. Again, this is one of the femur in your leg. Finally, here is the fracture of the kneecap or patella. Like I had mentioned, the patella is the hardest bone in the body, so you could imagine that this was a very hard fall.
Okay, so after a bone is broken, then obviously you take it and you get an x-ray to make sure that it's bad enough and to see where the bone is actually broken. And then if it is bad enough, a lot of times you'll go into a cast. So casting is actually very interesting. There's a lot of different steps. So cast can be applied by doctors, physician assistants, orthopedic technicians, or nurse practitioners. So a lot of people can give you casts and even splints. A lot of times, in a pinch, such as an ambulance, first thing that will be applied is a splint. So a splint, say I broke my arm, you can do a splint that just covers 2 of the sides and it hardens up and it makes sure that the bone is held in place if there's a weakness in there, so that the patient can be transported so that a more permanent cast can be put in place. There's actually different types of casts. The main ones that are used here at Iowa are the Fiberglass type. Those ones take about 20 to 30 minutes to fully dry and to support the weight. And these ones can be kept on for 4 weeks to 10 weeks. So it's a wide range of time, depending on how bad the fracture is, or how bad the break is, and how the healing is going. Casts also, they have an inner layer that's made of cotton, and then the outer layer is hard. So the harder outer layer is the fiberglass, and that's the one that you'll see is sometimes colorful and people can sign and all that fun stuff. And then obviously after your bone that you broke has healed, then you need to take it off. Alright guys, on behalf of the University of Iowa Carter College of Medicine and the Orthopedic Surgery Interest Group, thank you for tuning in to today's lesson. Goodbye.
Bye.